If you want to understand a complex problem, you need to look at it from as many angles as possible. You really do, and that includes ethics. And because something is inherently good, which we see in science all the time, does not mean every aspect about it is good.
Today, we're sitting down with Dr. Kerry Bowman, prominent Canadian bioethicist and conservationist. He's currently a professor at the University of Toronto's Faculty of Medicine and School of the Environment. He also once served as the clinical ethicist at Mount Sinai Hospital and UHN. Dr. Bowman is the president and founder of the Canadian Ape Alliance, a member of the board of directors of the Jane Goodall Institute, and works with the United Nations Environmental Program. Throughout his career, Dr. Bowman has been deeply involved in addressing complex ethical issues arising from advances in biotechnology, genomics, and healthcare. He's known for his insightful contributions to the ethical debates surrounding topics such as genetic testing, assisted reproductive technologies, and organ transplantation. And in fact, you may have seen him as a contributor on these topics on various international news stations. Additionally, his expertise extends to exploring ethical concerns related to global health and environmental health. He works in the Eastern Democratic Republic of Congo as a conservationist, working to help protect the great apes of Africa. He frequently consults internationally on conservation issues in various parts of Africa, as well as India, Indonesia, Brazil, and Iran. Dr. Bowman has consulted for the Center for Disease Control in Atlanta on research exploring the links between the hunting of great apes and the transmission of retroviruses such as HIV. More recently, Dr. Bowman has been spending time in the Western Amazon, where he studies uncontacted tribes and seeks to expand our knowledge on the interplay between biodiversity and global health. And without further ado, my good friend, Dr. Kerry Bowman. Kerry, nice to see you again.
Yeah, happy to do so. Happy to be here.
Now, before we get started, do you mind giving our students a bit of a definition of what bioethics is in terms of and how it applies to biotechnology?
Yeah, so the word bio, of course, is coming from the word biological, and ethics in the philosophical tradition is truly ethics. But biotechnology and bioethics, as we really look at the 21st century and this very rapid exponential explosion in biotechnology, bioethics is a profession and a science that's really trying to keep up with some of the implications, the broader social political implications, and by extension ethical implications of emerging biotechnology. So this could include a broad range of things, and sometimes it's not even necessarily tech, but it could be medical assistance in dying, reproductive ethics, women's health and women's reproductive rights. But very often in the 21st century, bioethics is about emerging technology and what are the ethical questions that it raises.
Now, there tends to be I would say, a void in undergraduate education when it comes to new students pursuing careers in biotechnology in terms of understanding bioethics, or not keeping that in the forefront of their mind when they are considering these technologies. Now, is that something you would suggest for young up-and-coming biotechnologists, no matter what field they pursue?
I really would, and universities, as you've pointed out, I mean, in a lot of ways, I would agree, are kind of scrambling to close this gap because with emerging science, some people would say if you look at something like artificial intelligence, it's barely here yet. Let's wait until we have all these social problems and then we'll consult bioethics. Right. But here's the thing, bioethics evolves the way science does, and it's kind of building blocks in a lot of ways the way science is. So you want bioethics to evolve with the technology. It's not a simple equation. So you really want to constantly, as you analyze something in a complex situation, one of the factors, if you've got a complex problem, you want to, and people in science know this, you want to look at it from as many angles as you can. But one of those angles is absolutely ethics as well. So you really want the ethics to evolve with the science. What is the pushback? Some people would say, well, the last thing we need is these sort of moralizing people slowing. Not everyone says that, by the way, but some do. Slowing us down. The purpose of medical technology is to make the world a better place for everybody. But these kind of facile statements without a deeper analysis, and that might be the intention. It doesn't mean it's the outcome. So, and in many cases, biotechnology does improve our lives. There's no question about that. But we really have, I would argue, a moral obligation to human well-being and environmental well-being to look at what the true implications of this emerging practice is.
Now, you said a couple important things there. You said whether it's biotechnology in health or medicine, but also agriculture or environment. A lot of people, when they think biotechnology, they overlook agriculture and environment, which is something that I know is very dear to your heart.
Mm-hmm.
So how would you separate how one would approach, or how would you differentiate, or is it the same, how one would approach the bioethics of medicine and biotechnology, and perhaps the biotechnology that takes place in the agriculture or environmental sectors? Is there a difference?
There's a difference, but there's similarities. And, one of the things that we would look for is a risk benefit. So, with biotechnology right now, you've got the genetic, as an example, you've got the genetic modification of mosquitoes. What are the benefits? Well, they could be huge. Mosquitoes do tremendous, not all mosquitoes, by the way, very few mosquito species are actually problematic. Most mosquito species are quite benign to human existence. But, and that's always the challenge, is people don't fully understand the environmental question. But they can do a lot of harm. What are the risks? Well, that's the issue. We don't really know. And one of the things that's really emerging with 21st century technology is we're looking at it often through a lens of 20th century bioethics. Big problem. Let's look at the risk benefits. If someone has a cardiac bypass, what are the risks? What are the benefits? Mostly you can get to the bottom of that and quantify that. But when you look at these complex issues like solar engineering or, the genetic manipulation of insects, the risks are really, really mostly unknown. You can make a guess, and your guess is based on here's how we see science in the year of 2023, which is a moving target. And that's the best we could do for now. But that's one of the great challenges, is this risk-benefit equation, which I'm not opposed to, is very hard to apply in 21st century realities.
Right. So, as you mentioned, 20th century bioethics really relied on the four principles of Beauchamp and Childress.
Yeah.
Right? We're talking about autonomy, beneficence, non-maleficence, and justice.
That's right.
Would you still consider that to be a foundation for 21st century biotechnology and bioethics?
Yeah, so in bioethics, it absolutely is within the practice of Western medicine. Bioethics very much relies on those four principles, but those four principles have limits.
Right.
If you look at autonomy, look, we all believe, many of us living in Canada, that how important autonomy is, but it's got some real limitations cross-culturally.
Sure.
And because autonomy is really based on a Western perception of the individual.
Right.
And so many people coming that are new to Canada, as well as the Indigenous people of Canada, the individual is not necessarily in all cases what is the most important factor. So they're problematic. And I am the first to admit that bioethics needs a whole lot of fresh thinking. A lot of the models we're using are challenging. I still see great importance with bioethics, but boy, we need some really new conceptual frameworks to work with.
Now, you're considered a prominent voice in bioethics, but it wasn't always that case. Can you give us a little bit of insight as to how you came to bioethics throughout your academic and life journey?
Yeah. I mean, I'll abbreviate it for our patient listeners, but I was a medical social worker, and I was working in a critical care unit. And what struck me in the critical care unit, and as a social worker in critical care, a lot of my responsibility was related to end-of-life decision making and supporting families with end-of-life decisions. Not everyone in critical care dies, but because of the nature of the job I had, I was particularly assigned to those cases. So one of the things that I saw very, very clearly, and I had also seen in my travels and working overseas, was there's profound cultural differences in how people perceive the nature and meaning of death, and how the decisions associated with an approaching death should be approached, or if there should be any decisions whatsoever. So, how does one pursue that academically? And so what I did was, bioethics was emerging. This is, in the 90s. I structured a proposal that I would go back to school for the several times. I'd gone back to university a couple of times. I hold 4 degrees. And for this degree, I would study cultural differences through a bioethical lens related to end of life decision making. So that's how I got there. And bioethics come from very different professions. I mean, one of the critiques of bioethics, and often the criticism for some, is that they are really not all the same. I mean, there's a huge variation in one bioethicist to another. So what happens in bioethics, which is a really important message for our students, is that there's almost always a core foundation before one becomes a bioethicist. In my case, I had a master's in social work. In other cases, people could have a law degree, a medicine degree, a psychology degree, something. Some people might have a background in philosophy, and that would be fine. But there's almost always a foundation that precedes bioethics. So that's an important consideration. And then, of course, a person's preliminary profession and career tends to shape our thinking the way a culture would in many cases. So I'm often going to be looking at things through a psychosocial lens as someone trained in social work. A lawyer may look at it differently, but that can be very enriching. It's not necessarily a problem.
Now, we got to know each other in the early 2000s when I was a student and a research assistant with you at Mount Sinai Hospital.
Mhm.
And I got to live through the whole 2003 SARS thing with you. That was an interesting thing, not unlike COVID, but on a smaller scale. You were the bioethicist at Mount Sinai at the time. Can you tell our students what is the day-to-day of bioethicist in particular for you at a hospital? What do they do? What are their responsibilities? What sort of things do they see?
Many, many, many. Let me just roll back a tiny bit and say that bioethics generally, if you want to, it's a little fluid, but generally you've got two categories. You've got academic bioethicists,
Right.
which are the ones that you tend to hear the most from, by the way.
Yes.
The most from, and the most common ones in media tend to be academic bioethicists. And we all know what an academic is, and we all know, so they stay within a university system. And then you have clinical bioethicists that in many, but not all cases, would work in hospitals. I have had a blended career in which I've done both those things. So a bioethicist in a hospital would be directly involved with questions where there's a clinical practice case where there's ethical tension related to many possible questions: consent, capacity, end of life decision making, cultural differences, emerging technology. There's a broad range of things that can emerge within a hospital setting. And so hospitals, or at least teaching hospitals, have healthcare teams. There's chaplaincy and social work and, if appropriate, neurology and whatever it may be. So a bioethicist joins those teams and becomes part of that team. So it's not so much for, me to make a definitive assessment of what should happen with a case, but my role in a case like that would be to really illuminate for the team and the family and the patient potential. I don't mean to put the patient at the end of the list, but what happens in bioethics referrals is the patient is not always, capable, awake. And in the many cases I had, the patient would be a baby, and so they're not participating in any of this. So that we would illuminate what the ethical questions would be associated with a situation. And that's what bioethics would do. Now, secondarily, there'd be a lot of education within the hospital itself, not the university. So getting together with a team of nurses to do an update on consent, capacity, perhaps new legislation, and then research, looking at, I don't know, anything from CPR, cardiopulmonary resuscitation outcomes and consent, those types of things. So that's what a clinical bioethicist would be. I must add this, though. It's changing a lot. And I do find that clinical bioethics now is increasingly procedural. And what I mean by that is they want bioethicists to create policies on visiting and cannabis use and various things, which is very, very important. But I must say that there's a movement within bioethics for it to become far more procedural and far less patient bedside.
Could you give us an example of where, without naming names, a dilemma arose where there was interplay between ethics and biotechnology, maybe a reproductive technology case, or some sort of case involving a technology?
Yeah, so a case involving a technology would be through in vitro fertilization. You've got a patient that is requesting to have, uh, that is requesting a transfer of embryos, and assuming she has embryos and she's 55 years of age. So what you're requesting is, should these embryos be transferred to someone at the age of 55? Is 55 inherently too old to have a child? I don't mean biologically old, because, and this is with assisted reproductive. Some would say, we really shouldn't be part of someone at that age having a child. Others would say it's completely the rights of that woman to have children. And some would say we don't want to be complicit with the kind of risks that a pregnancy at 55, a twin pregnancy at 55 could bring. So the ethical question becomes, can we apply our technology to this situation? And in reproductive ethics and other forms, it's increasingly common. It could be someone that's had 3, 4 rounds of cancer saying, I want you to help me with in vitro fertilization so I can have a baby.
Mhm.
People on the team would say, you're a cancer survivor, you've had several rounds, like, we're concerned you may not live long enough. Should we be part of that? And, so roll it back, I don't know, decade back, these things wouldn't be emerging, but they are now.
Right. And as you said, we have to balance 20th century with 21st century
Yeah.
ideals and ethics, and balance those as we make these decisions. Now, what about today? In your opinion, what are some of the most pressing ethical dilemmas that are popping up now with the rise and the speed of technological advance? Like you mentioned, AI, there's CRISPR, there's mRNA technology that we saw recently with the whole COVID vaccine. What would, in your estimation, is one of the more pressing dilemmas?
Well, I'm going to use a very dramatic word, but I'll use a dramatic word and then I'll explain the dramatic word I use. The dramatic word is eugenics. So,
Sure.
and what we mean by that is, creating environments, creating technology to further the genetic health and well-being and selection of how, in this case, people should be. Do we have eugenics right now? Well, we don't, but what we do have now is a growing amount of genetic testing. So eugenics historically is a very, very dark and ugly chapter of the human story. And it was not just the Third Reich. I mean, we all know what happened under Nazi Germany and, the mass genocide, which was eugenics based. And when I say eugenics, the belief that there's superior and inferior races, and remembering what happened under the Third Reich also involved LGBTQ people, people with disability. So, these are the types of people that are edited out of a society. I'm not suggesting for a moment that we have, the state has any sort of issue in things like that now. But what is happening is we have a high level of prenatal genetic testing. And sometimes it's not even prenatal. It's you can look right at embryos before they're even implanted into someone. So if you look at something like Down syndrome, trisomy 21, massive decline in that. Why? Because couples, women are brought the information that they're carrying a child with trisomy 21 and the pregnancy is terminated. And so increasingly what has happened, and some of these disabilities, not trisomy 21, can be quite debilitating. Others are not. And so slowly we're drifting into, and what's the ideal height of a male? What's the ideal, tendency towards athleticism, intellect? So we can't control those things now, but we're getting closer to it. So my point with what I would call a soft eugenics is that one of the things that's emerging, it's not just do you want to have a child, it's what kind of child do you want to have? And this brings us back in a very different way to the kind of eugenics movement that happened 100 years ago. And remembering there was a eugenics movement in Canada, throughout Western cultures, there was a eugenics movement. I worry about that a great deal. And we run the risk longer term, beyond the span of our lives, but not much, that we could really create a new strata of human beings in which we have genetically enhanced human beings and ungenetically enhanced human beings. Profound problems with equality, freedom, human rights could be constructed with that.
So you would say that we're moving out of the era of negative eugenics
and into the era of positive eugenics. Negative eugenics being we can eliminate, like you said, with embryonic testing of trisomy 21. Now we're moving into an area of positive eugenics using technologies like CRISPR to actively change your genome.
And it's a slightly different view. I mean, the eugenics now would not be based on race, or not that I can foresee anyway, but it still comes down to what are the best kind of human beings that should be born.
Right.
That to me is the eugenics movement. So that's one. Secondly would be artificial intelligence, which is so huge and complex. It's hardly, it's so hard to even begin to unpack
and seemingly
what it
just
is.
dropped in our laps in the last couple of months.
But it's huge. Yes. And artificial intelligence, there's just layers and layers and layers of ethical questions. Like you need a whole flow chart of the ethical questions that artificial intelligence brings up. But technologies will never stop because people have ethical concern. Market forces tend to drive medicine, and they drive emerging biotech. And if market forces drive them, they will not stop. I know that may sound a little cynical, but I believe it to be true. So if AI is here to stay, which it is, how can we, design it? Because it's a human product. It's a human product. How can we design it to respect, deeper human values?
Who and how codes the AI.
And, when I say human values, like, anyone could say to me, well, what does that mean? And then I would struggle because I can't speak for everyone on the planet Earth, right?
Absolutely.
And we don't all agree on exactly what those values should be. In a general sense, we do, but in a more granular sense, we don't. If I was asking people in the Russian Federation or the People's Republic of China, what are the most important values, you'd see differences.
Right. Right. Absolutely. And you mentioned emerging technologies, obviously a big part of biotechnology. So as biotechnology students, how do we balance the pursuit of new technologies and the ethical implications that might come with it? How do we balance that as young up and coming students who are going to be deeply involved in emerging technologies?
Well, I mean, I think on the scientific checklist, and there's lots of scientific checklists, ethics has to be a consideration. And if emerging scientists or scientists feel I don't even know where to go with that, they need to be humble and find ways and resources in ethics to help them frame those questions. Because it's not, ethics isn't just a question of do we have this technology or not have it, or throw it out or not have it, throw it out. But what an ethics review can do is to say, here's where the ethical questions are, and here's where the ethical tension is. How do we think about it? How like if we look at artificial intelligence, one of the many, many ethical concerns is that we're just baking in human prejudices. They're just being infused into this technology, right? So how do we get around that? How do we compensate for that?
Right. So then, as young biotechnologists, what skills and qualities do you think we should be fostering early on to be able to handle those bioethical implications? What makes a good bioethicist?
Critical thought, and that's a big issue for universities these days, right? We've got lots of people saying that these general university programs are ridiculous, and people have to have very targeted training, and they have to be more like a tech training program. But critical thought is what is needed, and particularly where do you get critical thought? It's usually at the undergrad level. And you need courses that reflect critical thought, and professors need to be able to, they need to be good teachers. They need to draw in their students and allow critical thought to flow right through the classroom and to really look at the complexity of how to approach these problems. I find one of the only ways to teach bioethics is to kind of model critical thought. It's not just me, I mean, to get the classroom going with it. The few students that don't do well in bioethics courses, or at least in mine, are usually, it's not really about aptitude. What it tends to be about is attendance. And what I mean by that is the few people that don't attend, because they're not modeling this sort of, semester or 2 semesters of case-based critical analysis, week after week after week. Sounds a little like drudgery. It's not. I mean, because the cases I think are quite interesting.
On the surface, bioethics seems to be book heavy, philosophy heavy, lots of reading.
Yeah.
But really, it's an applied type of philosophy.
It's applied, and I'm
a
strong believer in case-based teaching, and you know, the many years of working in hospitals has you know, been a great opener for me, because it's allowed me an incredible case bank of things that I can bring to the classroom. But you know, that for a student to say, I'm going to do bioethics online and I'm going to read, I guess it's possible, I don't know, I'm going to read 2 or 3 textbooks and I'll be fine. It will help them, but I would argue that, you know, people within a room deconstructing a complex case is the best way to model the kind of critical thought that goes with bioethics.
So that being said, how or why would you suggest that a foundation in bioethics would make you a better biotechnologist, a medical lab worker, or a geneticist? How would that make you a better scientist at the end of the day?
It would deepen your thinking, and it would help you see complexity, and seeing complexity in science is a huge advantage. And you know, science needs a purpose. And to simply say this is good for the world, and it probably is, but things can be good for the world and bad for the world at the exact same time. And you know, being able to see that is helpful. And I think it sharpens a person's intellect to be able to see that it pulls us away from single-minded thinking, that things are categorically black or white. That's good for the mind.
Now, we've talked about emerging technologies and the rate of an advancement. What about bioethics itself? What, in your opinion, is the most interesting field of bioethical research at the moment? Anything emerging, anything novel that we haven't seen in the 20th century?
Environmental ethics is very, very, very slowly emerging, and
Right.
a very complex challenge it is in relation to climate, and in relation, and it's not fully separated because it has to include human well-being. But ethics is very, very important with that. I think the ethics that's emerging with neuroethics is incredibly important, and that's kind of becoming an almost free-floating aspect or element of bioethics. AI ethics, you know, so bioethics is kind of branching off into all these things. I don't think they should ever be completely isolated. I think they need to you know, have some integration. But you know, I must say, it's also not rare for people that have taken bioethics courses to say, I thought it was going to be all these things, and it really wasn't. It was very bookish. It was very this, it was very that. So it does depend on how they're taught. And I do think, a little controversial here, but and I have a lot of respect for philosophy. It's the foundation of all of this. But to teach bioethics well for people that are moving towards science careers, you cannot teach philosophy alone. It has to be integrated with science and clinical practice for people to really sense what all this means.
So you yourself, you started out as a social worker and then a clinical bioethicist, but you have also branched off into environmental ethics and studying the environment. Can you tell us a little bit about what you've been doing recently?
Yeah. I mean, I've got broad interests, and one of my emerging interests was, well, you know, I've always loved equatorial forest and the creatures that live within them. There's no question. But if you look at something like, you know, the environmental destruction of the forest and its relation to zoonotic emerging diseases, that's just a whole range of things, including COVID, including SARS-1, including HIV, including Ebola. It's quite extensive. And, you know, it's actually a very strong example of how environment, you know, and science are far too separated from each other. And when you look at what's going on now, post-COVID, I'm not sure we're post-COVID, but I'm going to use the term for now. If you look at where we're going now post-COVID, you know, at most we're saying, let's get some international monitoring going on, right? So monitor, let's wait for these diseases to emerge, and we spot that there's a hemorrhagic outbreak in Sudan or some such thing, and let's take action. Sounds all very wise, but we've got this wrong. You have to go further upstream than that and say, why is there hemorrhagic outbreaks? You know, what's happening in the environment? And a lot of what's happening in the environment is just massive loss of equatorial forests, opening up, creatures, flora and fauna, particularly fauna, under great pressure, migrating under the stress of climate change, massive consumption of wild animals. So, these kind of pillars within education, that this is about medicine and this is public health, are very destructive, because, when people say, well, thank God COVID's almost over because this only happens once in every 100 years, we have no proof. All we can say is it's been 100 years since. That's all we know. I do not believe, and I don't know, but I do not believe that 100 years is a reasonable timeline for the next pandemic at all under these circumstances. So it does show that. And so one of the things is, by doing environmental work, my mind was opened up to the concepts like the one I just spoke about. My mind has been opened up with tropical forests now that I'm working in the Amazon and the Congo. The incredible importance of respecting indigenous people, respecting the integrity of the forest, and how human rights and environmentalism are just knitted right together. When you see the indigenous situation in the Amazon and the big picture of what's happening to the Amazon, you can't parcel it into, this is about the environment and this is about politics. These things are knitted together. And so that's why, environmental ethics is so very important.
So,
and the day may come where we stop using terms like environmental ethics and neuroethics because we're going to have such a deep integration, but we're not there yet.
So you'd say, in the sense, that ethics, whether it's bioethics or environmental ethics, is somewhat of a glue, like you said, knitted together, that keeps scientists and environmentalists within a parameter, a ethical box, so that we don't see things like outbreaks.
Yeah. And again, I'm not sure you always need, as a scientist, for someone with a PhD in ethics to come in and say A, B, C, D. But what you do need is the encouragement of scientists, starting, I would argue, at undergrad. Better than undergrad is actually high school. I've been doing some seminars in the high schools.
That's a very good point.
And they're very clever, wise young people. And that's an even better time. So early on, I mean, not elementary, because conceptually I think it's asking a little too much. But to really start talking about these things and allow the components of science to always include ethical questions. That's what's most important.
So as we close, could you share a piece of wisdom or guiding principle that young students should carry forward, keep in their back pocket as they progress through a career in biotechnology, that would set them on that right path?
If you want to understand a complex problem, you need to look at it from as many angles as possible. You really do, and that includes ethics. And because something is inherently good, which we see in science all the time, does not mean every aspect about it is good.
Well said. Thank you, Kerry. Appreciate it. This was fun.
Happy to do so.